Hi, my name is Kim McCarl, and I'm the Communications Officer for Contra Costa Health Services. Understandably, the shelter-in-residence order that was issued earlier this week has generated a lot of concern and questions. We invite the public to call our coronavirus call center at 844-729-8410. We've collected some of the most commonly asked questions and invited our County Health Officer, Dr. Chris Farnitano, to answer those for you. So first off, Dr. Farnitano, could you briefly explain what a shelter-in-residence means and why it is important?
The order requires all residents to stay home to limit the spread of the novel coronavirus, also known as COVID-19. Everyone should stay home except for essential needs, such as getting food, caring for a relative or friend, getting necessary health care, or going to an essential job. We are recommending that those at higher risk of getting severely sick stay home as much as possible. Now is the time for all of us to do everything we can to prevent the situation from getting much worse. We need and appreciate the cooperation of everyone who lives and works in Contra Costa County to act immediately. While this news may feel alarming, it is a necessary step that we hope will save lives.
The biggest question we're getting is, what is an essential service? Can you tell people how the order identifies essential services and give us some examples of businesses and services that qualify?
The list of essential businesses and services is very long and would take some time to discuss. I would recommend that people go to our website, cchealth.org, and take a look at the order directly. The section F in the order explains all the services. However, some of the key services do include healthcare providers, first responders and law enforcement, and other services we need to continue to get by, like banks, grocery stores, transportation, and gas stations. Restaurants can stay open too, but they only can do delivery or takeout.
Can you specify what you mean by people at high risk for COVID-19? What are the ages and what are pre-existing conditions?
The best available evidence shows that the risk of severe illness begins to increase at age 50 and increases dramatically with age. The highest risk group is people who are 80 years or older. Adults and children with underlying medical problems are also likely at higher risk for severe disease, including those with diabetes, heart disease, lung disease, cancer, as well as those who have weak immune systems. By complying with this order, practicing good hygiene like washing your hands regularly, and maintaining social distances of 6 feet apart, you can not only protect your own health, but also those at most at risk.
So we heard from a landscaper who said, I can operate independently and without interactions with other people. Can he still work?
Landscaping is not considered an essential service, so that would not be an allowed type of employment.
Is the county planning to release a list of areas that have been affected by coronavirus? Some people are interested in curtailing their shopping activities and restricting it to communities that are coronavirus free. Will the county assist them with this?
This order applies to the entire county, and similar orders apply to the entire Bay Area because the virus can't be pinned down to a specific neighborhood or area. The more we test, the more we find. That's why it's so important to practice social distancing and sheltering at home. I appreciate it is very tough, but if everyone complies, we can slow the spread of this virus. The important thing is when you're shopping or out of your home to practice social distancing and be certain to wash your hands thoroughly before and after shopping.
What kinds of outdoor activities are permitted under the order?
We do encourage people for their own mental health to get outside and exercise. The East Bay Regional Parks is remaining open as long as you comply with social distancing requirements. So keep a safe distance from your friends or relatives, and if you're walking, hiking, or running, enjoy the outdoors safely.
Finally, there's an understandably high level of fear and anxiety. In normal circumstances, we turn to friends, colleagues, and neighbors to work through those feelings. Do you have recommendations of how we might stay connected while sheltering at home?
That's an excellent question. This is a very stressful time, and for our own mental health and for the mental health of those we care about, it's really important to stay connected by phone, by social media, arrange to go out with a friend to a park and take a walk while maintaining good social distancing. We need to stay connected. We need to support each other during this difficult time.
Thanks again, Dr. Farnitano. Hopefully this helps answer some of the questions that are foremost on your minds. We are constantly updating our website, cchealth.org, with questions and answers as well as a wealth of other resources to help you manage through this tough time. So please visit it frequently to stay abreast of this evolving issue. Also, the call center is open from 8 to 5, 7 days a week to answer your calls. Call us at 844-729-8410.